So, if a service provider is providing mental health and psychosocial support to a couple or a family and becomes aware of gender based violence being perpetrated by one individual in the couple or family against the other, the survivor's safety immediately becomes the highest priority. Support should be provided individually to the survivor without her partner present, including services, safety planning, and referrals in line with her wishes and informed consent in a manner that does not further endanger the survivor. Within group-based psychosocial support sessions, if a participant discloses perpetrating violence, the facilitator should not use the group setting to share the perpetrator's experiences or use that example or that incident as an opportunity to learn from others on problem-solving approaches and ideas.
In a situation like this, the staff member is going to want to consult with their supervisor and try to strategize the safest way to prioritize work with the survivor individually without placing them at further harm from the spouse or the perpetrator in that situation.
If a survivor asks service provider to mediate or provide support jointly to the survivor and perpetrator in cases of gender-based violence, service providers should explain that they cannot do this because of the increased risk to survivors and staff when engaging in mediation processes. In situations of intimate partner violence, service providers should not mediate or provide joint psychosocial support, even with consent from the survivor.
So MHPSS and GBV providers both have really important roles to play when responding to the needs of a survivor. They are key in providing referrals, which ensures more of a holistic response to the survivor's needs. We also need clear guidelines for both the GBV and MHPSS actors that outlines how to respond when a survivor or perpetrator discloses violence in counseling, whether it's couples counseling or a family setting, or even within a group session. So it's really important to have guidelines in place to help service providers know exactly what to do, and especially what to do in situations where there's a request for mediation by the survivor.